You don't want to misdiagnose things like that. So I had a gentleman come into our office and he had back pain, and he just wanted some musculoskeletal care. He wanted to be adjusted. That's all this individual wanted. And I knew that he didn't look right. I needed to do some testing, and he was resistant to doing some testing. So I did some lab work with this individual. And what we found on his lab work when we did that, we found that he had several markers, such as his SED rate, which is an inflammatory marker, had some vitamin D, had some other things that were off, some inflammatory markers, but his CEA, his marker for inflammation in the intestines, basically, was elevated. And basically, he had intestinal cancer. You don't want to misdiagnose things like that. It's important to do the right testing. But when you're actually doing a more extensive test, you can actually look and see at those inflammatory markers that indicate autoimmune conditions. You can look at those markers that indicate possible, cancer involvement too. Well, let's just take an x-ray and send them out, maybe, or just adjust them or send them to PT. So a functional blood work analysis, yes, does the proper testing. It also takes this whole body approach. It doesn't just look at one thing, because as you know, as I just said there, those that have fatigue or weight gain or pain, that could be related to sleep apnea or anemia. It could be related. So you need to look at the whole body and understand how interconnected those are and how each one of those can cause those symptoms.